Thank you for being here. My name is Herbert Quinz. First of all, I have to beg excuse for my English. I'm Italian. My wife came from Barcelona. We are living in Germany. We speak Spanish at home. And since we were in the Provence this year, I'm trying to study French. And so I have a little bit like Esperanto in my mind. And I beg excuse for this. Actually, I'm a physician. I'm a cardiac surgeon. But since 10 years, I'm working in hospital management in the University Clinic of Augsburg at first, and since 1 year, more or less, in Nürnberg, which is one of the biggest clinics in Europe, with about 2,600 beds. I will speak about my experiences in digital transformation in hospitals and healthcare, and it is very complex in the hospital context. We have a lot of stakeholders, patients, the healthcare operators, all the professionals, the administration, and also external problem makers like the regulatory bodies, which in Germany are very heavy with new constraints and the legal requirements. We have a lot of innovation in hospital care or in healthcare, and we have to choose between technologies, and we have to think about the future of these technologies and how good they could implement in the complex systems that we have. We have, as I said, a lot of legal requirements in Germany. Data security with the progress of digital transformation is and would be a major concern. Compliance, privacy, and so on. Then, as we heard now, we have a lot of old legacy systems in the hospitals, and with proprietary data governance, and we have outdated infrastructures in network and hardware. We see it now with we have to pass from Windows 10 to 11, and there are very simple things that in a big organization are complicated. We have budget constraints, and on the other side, high costs. What in regard of digital transformation, and in hospitals often we don't have adequate methods like project management or change management, and change management is a very important point in digital transformation in hospitals. We are here in Germany. We think we're in Western Europe, and the reality in many hospitals is paper-based, which has a lot of problems. Patient security, availability of documentation, but that's the truth. In many hospitals, we're almost paper-based. Why should we change? Why should we leave this secure and known paper world? On first hand, as I mentioned, patient safety. Quality of care can be improved. We can optimize our processes, and we have not a lot of resources, economic and the other one. And with automation and digitization, we can optimize our actual situation. And what we actually need in Germany is to improve the communication between the different sectors. We have a very big gap between inpatients, outpatients, and all the healthcare operators. What are the digital outcomes where we in Nürnberg look at? Improve our healthcare services, improve the patient satisfaction, as we saw in the first speech about the patient journey. We have to improve our attractiveness for our employees. We have to save costs and increase our efficiency. And on the other hand, we want to support research. We want to provide good data for our research colleagues. I think for digital transformation in hospitals, we need a vision. This vision will define our goals, which are more concrete. We need a strategy, how to reach to these goals. We need methods, as I said, like project management or change management. And on the other hand, we need leadership. The vision, how I say, is very important to also give a little bit of motivation in terms of change management to help to improve the acceptance of transformation. And why is leadership important? On the one hand, to define this vision and to bring innovation culture in the enterprise, but also setting priorities in the strategy to allocate well the resources, selecting people of the enterprise who can bring on the digital transformation, to ensure an alignment to the enterprise goals, to do the change management and the risk management in this kind of transformation. I brought a little book from Drucker, which is very important in the development of management. It was published in '64, and I found a few ideas very interesting. The first one focused on opportunities, and so we also in change management or in digital transformation should concentrate our resources on the most promising roads, or not on fixating our problems, which in hospitals is very often the case, that we are fixating problem, but not the solutions and not where our strengths are. And another important point from my point of view is the proactive leadership. And afterwards I will show you a quote from Drucker who says, "The best way to predict the future is creating it." And it's this idea of proactive leadership. I think we have two different ways, two different approaches for digitization. On the one hand, we have a medical strategy, a corporate governance, and we optimize our processes. And on this base, on the optimized and designed processes, we put on our digitization or digital transformation. On the other hand, we can have very good products, digital solutions, and the organization or the digitization is a driver for the processes, and the organization moves after the digital tools. But what I think is very important now in the governance of hospitals is that the information technology plays a key role even in the organizational development of the enterprise. 1 year ago I came to Nürnberg, and I didn't find a strategy, so we started with it, with analysis, with defining goals, the vision, the mission, action fields, and a roadmap. And we terminated it now. It was a very big work. The analysis phase was characterized by structured interviews from the nursing staff until the chief executive officer, with a lot of workshops, SWOT analysis, something like that, and also technology trend analysis. And we focused on 3 objectives: the patient first line, our employees, and the processes. And on the other hand, the data exchange and connectivity with interoperability as keyword. From these focal objectives, we were able to define action fields, concrete action fields, like patient-oriented technologies, process automation for increased efficiency, data value creation, data analytics, interoperability, IT security, cybersecurity, data protection, and on the other hand, also structural things like training of digital skills on one hand, and on the other hand, management, like project management skills or change management skills. that's now a slide of the short term goals. We had a classification of short, medium, and long-term goals, and have broken it down to very specific, concrete points in our digital strategy. From my point of view, it's important to align digital transformation and all the related projects to the corporate strategy. We have to prove if there is compatibility in the organization. Also, the financial side, the project must be feasible. In Germany now we have the very advantage of the Krankenhauszukunftsgesetz with European funds which went to hospitals to improve the digitization. And here in Germany, very important the legal requirements, which are for us very important to influence our prioritization of different projects. That's just the example how we tried to do this alignment goals of our enterprise and the different action fields, and we say there is a lot of parallelity. If you have a nice strategy, you know your action fields. I think it's important for the organization to have very good founded and structured methods. I'm a very fan of project management methods because what I saw in hospitals often is are uncoordinated measures. So the strategy gives the line and the methods help to implement the different projects. And that's a very nice book, 4,000 Weeks. Time management. It's about time management for mortals. The author says we have about 4,000 weeks to live. And the most important thing is, or the real measure for management techniques or time management techniques is whether or not it helps you neglect the right things. So do not to do the right things. And yes, the bananas are the symbols of the age. I would be with 45 years, the third, I think, a little bit brown. What I wanted to say is that it's very important to prioritize what we are doing and what we are not doing. In hospitals, often you have a lot of different projects and measures, but they are not coordinated, and you haven't the resources to do everything you want. The next step is to build a roadmap. The roadmap would be very not so complicated in the beginning, but if you go on with the self-assessment, the strategy planning, as we say, and then the implementation, must be revised regularly and will grow as further you go. In hospital, you have a lot of stakeholders, as we saw, and there are a lot of subjects that need to be considered. You have the user, maybe the user should be in the center of this circle. You have the administration with needs, with data needs, with different perspectives. You have the enterprises with the products, with proprietary, mostly proprietary way of data governance, and on the other hand, you have business constraints, as we saw. To bring together all these different perspectives in hospital, I think change management is a very important thing to think about and to implement in our projects and in the digital transformation. And in my experience, it's important to have a dedicated change team, persons in the enterprise who live change management and are in the different projects and can bring the drive for change management, and also to be sensitive and have sensibility which the enterprise and the employees bring to us. which fears or motivation they have. It's very important to have an open and effective communication until the singular employee, from my point of view, and an aspect of change management which works very well. Often we speak about low-hanging fruits or quick wins, and that kind of thing could be important to improve the acceptance of the employees. And also, when we finish a project, that we see the success and try with different things to say thank you to our co-workers. In Nürnberg, we have a lot of activities, communication activities, town hall meetings, a lot of trainings, and as you see from these photos, the middle one are from a PDMS implementation on the ICU. It seems that the employees have a great motivation to implement new technology and digital transformation. From my point of view, there are some key topics. We saw some of them in the other very nice speeches. Cloud computing is very important, but in German hospitals and in German healthcare, not so well seen because of privacy concerns and IT security concerns. We have to make a change, to change the paradigm and to open our minds for cloud computing. I think automation in hospitals is a very, as we saw again, it's a very important aspect. We have not a lot of employees, and we have demography which grows in the last end. Artificial intelligence and machine learning is now a word in the mouth of everybody, but we have to see which are the application use cases which really work. We see a lot also in our hospital, but a lot of use cases are just nice to have, but not really improving our way to do our patient care. Big data and analytics is important for personalized medicine, is important for research. Interoperability is very important, and there are different ways from research aspects. We have the Medizininformatik Initiative here in Germany. Then we have the Telematik infrastructure, which needs another interoperability. And on the other hand, we have a lot of systems with very proprietary data. Internet of Things, as we saw, would be important, sensoric, for the preclinics in preventive medicine, but also in the clinic. And as we saw, 5G with a lot of use cases and the interesting view what would be and could be possible in future. In Nürnberg, we're thinking about implementing a 5G private network. And just for as a practical example, until now, only people with programming skills could digitize. And now we have the first systems which combine artificial intelligence with RPAs. And so also people which have no programming skills can with very easy editors, applicate AI and RPAs and generate automation. That's another very nice book. Topol is professor in Stanford for cardiology. He's a bestseller author, and in this deep medicine, he describes the evolution of AI a little bit. And what is very nice is the humanistic worldview. He says on one hand, the technology led us to have a very poor human or humanistic medicine. And he postulates that when we go further with technology and digital transformation, we will step back to a very humanistic medicine with our patient in the center. And an example could be this, which we actually are using now and testing in Nürnberg with speech recognition. The physician speaks with the patient, makes the anamnesis and so on, and the AI, which recognize the spoken words, transform this in structured data. And so you have an anamnesis, you have a loaded doctor's letter, or also you can give comments like, I need a CT for this patient, and in this way you can concentrate really on what your patient say and on your patient, and not on typing the words or doing comments on your laptop. This is or a very positive side. The other hand is that the business continuity. Here there are a lot of examples of ransomware or malware attacks in hospitals in Germany. Is a major concern, and so we have, when we implement the digital transformation, always have this aspect in the background and try to build very resilient systems in our hospitals. So, as a conclusion, can say, I think in hospitals and in the context of digital transformation, you need a vision. From this vision, you postulate your course, your action fields. You need a strategy, very good methods, project management, change management, and we have a few technological key topics which we have to focus in the next years or until now. And other term this quote from Peter Drucker: the best way to predict the future is to create it by your own. Thank you very much.